Hi, everyone. I'm here with Dr. Alan Guerci. Dr. Guerci and I know each other for about almost 30 years. We've worked very closely together, and we've been through many, many things together, but nothing that even gets close to what we're going through together right now. Dr. Guerci is the CEO of Catholic Health System. He runs our 6 hospitals, and I asked him to take some time out of his very busy schedule to talk to us and share some things with us. Good afternoon, Alan.
Hi, Rich. Let's wait for that phone to stop ringing. There we go. The American healthcare system hasn't seen anything like this since the influenza epidemic of 1918, which killed more people than the First World War. And for people of our generation who were born after the Depression and after the Second World War, this is really the first time we've been asked to make sacrifices. As in any crisis, the crisis brings the best and the worst out of people. And fortunately, for the most part, we've seen the best. So the first thing I want to do is thank the doctors, nurses, and support staffs of all of our hospitals for their dedication and courage. We have thousands of people who are putting their lives on the line. They're putting themselves in harm's way every day. That said, what the administration of Catholic Health Services has tried to do is ensure adequate supplies of equipment and personal protective equipment. So the first form of equipment is ventilators, since what COVID-19 does most often and most seriously is cause pneumonia. We bought about 50 more ventilators. We have a 3D printing operation that has produced connectors so we can double up on BiPAP machines. We haven't had to, and ventilators, we haven't had to do that yet, but we can if the need arises. And through the truly heroic efforts of our supply chain, we have been able to provide an adequate supply of face masks, face shields, and gowns. Now, they're still being rationed, but nobody's been asked to go to work without full personal protective equipment.
So major change. I mean, at St. Francis, we have a lot of things we do here. A month ago, I was doing multiple procedures every day, and now my life has turned into being more of a social worker than an interventional cardiologist. So it's certainly a change for us, but for administration to adapt, I'm sure you and the rest of the administrators had to do tremendous things to change us from, at least St. Francis, a cardiac center into a COVID center, and you've seen that in all 6 hospitals, I imagine.
Well, we have. So beginning about 3.5 weeks ago, we canceled all elective procedures: surgery, cardiac catheterization, electrophysiology studies, and even a few odds and ends of other procedures. We did this to conserve ventilators, intensive care unit beds, and staff. The financial consequences of this have been challenging. We estimate that for 2 reasons. First, the cancellation of elective procedures, which is where we make most of our money. And second, because reimbursement for COVID-19 hospital admissions does not fully cover the costs of providing care to those patients. We estimate that we're now losing $25 million a week. And St. Francis, which is our flagship hospital, which has the busiest caseload of surgery and cardiac procedures, is taking the biggest hit. So anything people can do to help us will be enormously appreciated. I think realistically, it's going to be another month or two before this situation settles down to where we can start to plan to gradually reopen the hospital. In that context, we're recording this session on April 14th. The number of COVID-19 cases at our 6 hospitals has leveled off. But to give you some sense of the magnitude of this crisis, about 2/3 of all of the patients in our hospitals, including St. Francis, are in the hospital because of COVID-19 pneumonia. 2 out of every 3 patients. So
amazing. A month ago, we had 1 patient in our hospital. How it just astronomically changed.
Yes, and the patients who need ventilator support, as you know, are sometimes on ventilators for 2 and 3 weeks. It's not like congestive heart failure where maybe a day or 2 of ventilator support helps a patient turn the corner and they go home a few days later. These patients are in for a long haul.
Well, Alan, I know you mentioned 1 to 2 months, and nobody really knows when the right time to open is, and no matter who the politician is doing it, whenever it's done, it's going to be criticized, right or wrong. But at some point, we're going to have to take care of our heart patients again, and it's going to be a major challenge for every hospital, as well as other aspects of society, to integrate patients back safely. And that's something I know you're working on. And, I'm sure we don't have our final plans out, but that is something that's going to be concerning. Is it safe to go back to a hospital, and how we're going to do that?
Well, that's a key question. There are very few elective cardiac procedures. And at some point in the not too distant future, we're going to have to create a COVID-free section of St. Francis Hospital and bring patients in and get them in and out quickly. A serologic test for immunity would help enormously. We don't know for a fact whether infection confers lifelong immunity, but there are reasons to believe, because of our experience with other viruses, poliovirus, for example, or measles or mumps, that infection does confer lifelong immunity. So if we could develop a unit where we have COVID-free staff and COVID-free patients, and we could get patients in and out quickly, we could begin to resume our core activities.
Well, I know we have so many people working on this to try to get us back to some normalcy. And I really appreciate you taking the time to speak with us. And we're hoping to raise a lot of funds for Long Island. We have a lot of people rooting for us. And I appreciate all you've always done for St. Francis and CHS and for me, and now what you're doing for us in this crisis. Thank you, Alan.
Well, St. Francis is a regional treasure. I spent 12 years at Johns Hopkins before coming to St. Francis. I didn't have to leave Johns Hopkins. They made a counteroffer. In terms of every aspect of the quality of care provided, very simply the best hospital I've ever seen in my life. I think we have the best cardiac cath lab in America. Our electrophysiology laboratory results are better than anything that's ever been published, and we have great cardiac surgery. So we're chomping at the bit to get going again.
Thank you.
Thank you, Rich.
Take care.